Welcome to the Malek Clinic for Natural Healing, where we offer forward thinking solutions for your health. I'm so glad that you've decided to join me. So, before we get started, I would like to just go ahead and introduce myself. I'm Dr. Nadia Malek. I am a chiropractic physician. I'm board certified in clinical nutrition and in internal disorders. I've been in practice for over 30 years. Most of those have been in the field of obviously natural and functional medicine. It is my passion. And my focus is on chronic illnesses. So when we're talking about things like thyroid or a hormone rather, or even adrenal dysregulation or disruption, remember your hormones are your uh, signaling chemicals in the body. We're talking about gut dysregulation. In other words, things like GERD or indigestion or reflux, which is GERD basically, or IBS, or even inflammatory conditions of the gut. Anything that relates to the gut. Things like intestinal permeability, which is a fancy medical word for a leaky gut. Those things are part of what I work with. Immune and autoimmune dysregulation. And of course, when it comes to thyroid, one of the biggest issues today is autoimmunity of the thyroid or Hashimoto's thyroiditis. But that's in my next lecture. And of course, genetics and DNA nutrition. I really like that because what I find very often is that if someone has some genetic polymorphisms or variants that have the potential to create a problem for them, we can sometimes compensate for these variants and help to at least minimize any potential risks or problems associated with polymorphisms. Remember, we're born with our own set of genes. There's nothing we can basically do to change that, but we can compensate for those variants. The other thing that I work with is emotion and anxiety disorders, and that's huge today. And very often, those anxiety disorders may be actually rooted in an organic or physical issue, and sometimes they're not. Actually, a lot of times they're not. Most of us don't live exactly in a totally stress free world, and most of us have a lot of things that we have to deal with, and not just external stressors, meaning things that are outside our body, but internal stressors, meaning things that are within our systems that aren't working as they should. So, emotion and anxiety disorders are huge today. And I also work with those. I am an author. I'm the co author of Cracking Your Thyroid Code and also the Thyroid FX Cookbook and the co founder of Wellness University. Now, if you're looking for me, you can find me at drnadiamalek.com and you can find me also at the Thyroid Code, or not the, excuse me, but thyroidcode.com. My practice is currently in Lake Worth, and I work with both clients that are local and around the globe. Lake Worth, of course, is in South Florida, just in case you weren't sure. All right. So before we get started, I just want to sort of clarify a few things. First of all, the information that I'm giving you is not a substitute for medical counseling, and it is not intended for diagnosis, treatment, or cure of any medical condition. So if I should happen to mention supplements or ways of or diets or anything at all, please be aware that these have not been evaluated by the Food and Drug Administration, in particular any kind of supplementation or any kind of nutrient. So make sure you always talk to your healthcare provider before you undertake any kind of treatment approach. So let's get started. Unidentified infections. I call that the stealthy elephant in the room. And truthfully, as we go along, as you see how these things operate and how they can literally change the way your body works, you'll see why I'm saying it's the stealthy elephant in the room. So, as you know, I like to start with a little quote that sort of encompasses what we're going to be talking about. And this one is by Elisha Bartlett. Certainly, it's by their signs and symptoms that internal diseases are revealed to the physician. Now, you're going to see that in stealth or hidden infections, that is really and truly evident. And the reason for that is because very often, whatever testing that's available out there to detect some of these bacterial or viral or parasitic infections aren't really that accurate. In other words, it's not that they're 100% accurate, where if you do the test and your results come back negative, you are negative for sure. No, no, no. In fact, 60% of the time, and we'll cover that as we go along, they might show the presence of the organism, but 40% of the time, and sometimes up to 50% of the time, they don't. So how do we know? Well, because you tell us you don't feel well. Your signs and symptoms are truly what tell us what's going on in your system. So it's so important for whoever you're seeing as a healthcare provider to be listening to you, to be listening to what you have to say and not dismissing your symptoms simply because there's no hard copy evidence that these infections are there. So I want you to consider this, okay? Unidentified, well, hidden, well, really more stealth, we're really more, I don't know what it is, right? So stealth, let's kind of define stealth a little bit: secret, clandestine, and surreptitious. Now, it very much describes what goes on in stealth infection, because in stealth infection, there's an immune invasion by a pathogen that is very hard to find. It's really difficult to find it. And as we go through the ones that we're going to be covering today, you'll see what I mean. So what's the problem with that? Well, the problem is you don't feel well, and if you don't know what's there, then how are you going to take care of it? How are you going to handle it? How are you going to manage it? How are you going to treat it? How are you going to get rid of it? And if you don't do anything about it, what's going to wind up happening is you're going to be very, very sick. And you'll be very, very sick without ever knowing why. You know, there's a medical term called idiopathic. Idiopathic means I don't know. So anytime someone goes to see a physician and they're told, well, you have an idiopathic so and so, it's basically telling you that, well, you have this condition, but we really don't know why you have it. Well, sometimes you have to look deeper, because your body doesn't just break down for no reason at all. There's a reason why something is happening. So you have to look beyond the idiopathic and get to the bottom of things. So when you don't do that, when you wind up with a quote unquote idiopathic, then you, of course, being the person that doesn't feel well, winds up going from doctor to doctor to doctor to doctor, trying to find a solution, trying to get well, and never really ever getting there. How frustrating is that? So how would you know? How would you know whether or not you have these infections? Well, that's the million-dollar question. And the problem with these infections is they're super hard to detect. And not only are they super hard to detect, but most conventional medical establishments don't even believe that a lot of these infections are even present. They don't even believe that they even exist or that they're even real. Now, of course, as I said earlier, there are blood tests that will test for these, but at best, they're maybe 60% accurate, and at worst, maybe about 40% accurate. So it makes it very, very, very difficult to really detect these, hence hidden or stealth infection. And that's the reason why these things continue to go undetected and untreated. So why don't we go over some of these so that you can get an idea of what we're talking about? So here are some of the more common stealth infections. Now, I'm sure you've probably heard of some of these. So let's start with, there are about 6 different bacteria, as you can see. And the first one I'm going to talk about is Borrelia, and then the Bartonella, Ehrlichiosis, Rickettsia, Chlamydia, and Mycoplasma, all of which are typically bacterial infection. We're going to cover some of these. We're not going to cover all, but you're going to see that, they have a lot of similar qualities. We have a parasite, Babesia, and Babesia is actually very similar to malaria in its invasion of the body. We have 2 viruses, Epstein-Barr, which is highly common, as you see, because it's going to be one of the bugs that we're going to be talking about, and cytomegalovirus, which is also almost as common, but not quite. And Epstein-Barr and cytomegalovirus actually work very similarly to each other, and both of them have a preferred kind of breeding site, if you will, and that's the liver for the most part. So let's talk about how stealth happens. How does stealth happen? How in the world would that happen? Well, the biggest way stealth happens is through immune dysregulation. And that's the other $1 million question. Okay? We have to ask ourselves, why doesn't the immune system eradicate the infection? Okay? Why doesn't it get rid of it? Well, because it's not working the way it should be working. Well, how is it supposed to work? All right. So in order for us to really be able to know that, let's take a peek at the immune system. So most people, when asked what the immune system is, would say, well, it's your body's defense mechanism. Well, that's true. It is the defense mechanism, but most of us actually think of the immune system as kind of some vague, mysterious power in our body that's supposed to protect us from infections. But nobody really knows where the immune system even lives. Because if you say to someone, hey, do you know where the immune system lives? Let me ask you, do you know where the immune system lives? What would your answer be? Something like maybe, well, I think it's in the blood, or maybe it's in the liver. Well, you're not completely wrong. The immune system is in the blood. It is in the liver. It's actually all over your body. It is everywhere. And you can see from this illustration that, the main immune glands include your tonsils and your adenoids, your spleen, your thymus, and your bone marrow. And then, of course, we have the lymph nodes, and the lymph nodes live everywhere on your body, and the lymphatic vessels. Now, I don't know if any of you are aware, but your lymphatic vessels and your lymphatic channels don't have their own pump, like the heart, for example, is the pump for your blood circulation. So they rely on movement and indirectly on the pumping of your blood in order for the lymph fluid to move through your system. So movement is super important for the lymphatics to really work well. One of the ways that I'll tell my patients to kind of move their lymphatics is to bounce or rebound. And that's a great way to sort of move things around. Walking is really good. Running, if you're able to, or if you don't have any knee injuries or hip injuries or back injuries that prevent you from doing that, is another good way to move your lymphatics. So moving the lymphatics is super important to get that fluid to move throughout the body, allowing the immune system to reach every part of your system. Interestingly enough, the biggest store of lymph nodes is in your gut, and they're called the Peyer's patches. And we know actually that your gut is so important to helping your immune system and helping educate your immune system, as we've talked about probiotics in the past and how important probiotics are in helping your immune system adapt. And we're going to talk a little bit more about adaptation in about a second or so. The appendix. Now, interestingly enough, most people used to think the appendix was just this kind of useless piece of vestigial tissue just hanging off your intestine, but the appendix is actually so much more than that. And one of the things that's been theorized about the appendix is that it might actually be sort of a repository or a reservoir for your healthy probiotics, so that if it needs to replenish your probiotic population for whatever reason, it's able to do that. Now, I've not yet seen anything that's any kind of evidence or research to that effect, but it is one of the theories out there about the immune system. So let's move on. Let's talk about the cells of the immune system. And you can see you have quite a few of them. And that all starts with the stem cell. The stem cell being the sort of unchanged cell that your bone marrow makes. So you remember on the illustration prior to this, we talked about the bone marrow and the bone marrow being part of your immune system. Well, yes, it is, because your stem cells that make your immune cells start in your bone marrow. And these stem cells differentiate into lymphocytes and granulocytes. Now, the lymphocytes are cells rather, that will kill typically viruses, but they kill just about everything. For example, your natural killer cells are kill bugs, but one of the things that they also clean up are cancer cells, because people, all of us, will have some undifferent or some lots of not what I'm looking for is very highly differentiating cell, meaning a cell that multiplies constantly, making a cancer cell. We all have these cells that happen that just don't have a stop switch, but the natural killer cells, as long as we have healthy levels of natural killer cells, clean them up. So most people don't get the cancer. It's only when the immune system is starting to get low, when it's not able to rally and do its job. That's when we see cancer cells able to grow. Now, those lymphocytes mature in certain places. The B lymphocytes, for example, mature in the bone marrow, hence B as in bone marrow. And the T lymphocytes mature in your thymus, the gland again that we talked about in the illustration prior. T for thymus. So your immune system has an amazing capacity to just move through your body and do what it needs to do and clean up. I mean, we have everything we need in our bodies to clean up so that we don't get sick, so that we don't get chronic illnesses. But sometimes these cells don't work as they should, or other things happen that cause our immune system to malfunction. The granulocytes on the other side of this chart, things like neutrophils, etc., those get rid of bacteria typically. Again, typically, nothing is ever 100% in the body because we have so many backup systems that really are able to take care of just about anything that we're exposed to. Eosinophils, those are typically the cells and basophils that rise, and mast cells when we have an allergy to something. Mast cells are what release histamine in our body. Histamine is what makes us itch, or what makes our eyes water, or what makes our nose run. Again, our immune system at work over here. And of course, the monocytes and macrophages, that's your cleanup crew. That's your cleanup crew. So let's move on further and let's sort of go over the purpose of the immune system. So the primary purpose of the immune system, what it's most intent on doing is protecting you. The immune system is your defense system. It truly is. And it's primarily for protection. So for the immune system, anything that doesn't look familiar to it is dangerous, and it's going to go after it. And the way it's going to go after it is first it's got to identify that it's not familiar. So when it sees something floating around in your bloodstream, it's going to think, well, do I know you or do I not? If it knows you, it's just going to be fine. It'll leave you alone and keep on going. But if it doesn't know you, that's when it's going to come after you. And the dendritic cells, the cells that we talked about in the previous slides, those are part of your monocytes, are going to latch onto this foreign invader and it's going to present it to the rest of your immune system. In other words, it's basically like a bouncer that latches onto somebody who's not supposed to be somewhere and takes it over to the bar owner and says, hey, this guy's been making trouble. I'm going to toss him out. And that's basically what your immune system does. It latches onto the foreign invader and it takes it to the immune system and says, you need to get rid of this because this is not supposed to be in here. And so the immune system revs up, destroys that foreign invader, and tosses it out of your body and then cleans up the debris. But here's the interesting thing about your immune system. You have a certain portion of your immune system that doesn't forget. In other words, it remembers that invader. And it does that by creating antibodies, okay, that are ready to destroy that invader the next time it will have the nerve to show up in your body. And this is where we differ in these antibodies. This is where conventional and natural approaches diverge when we talk about antibodies. And when we talk about antibodies, we're talking about immunoglobulins. So here I've listed some of the main immunoglobulins in our bodies. Now, bear in mind there's at least one other, and that is immunoglobulin D. But the ones that are most kind of involved in the way our immune system works are the ones that you see here, immunoglobulin M, A, G, and E. Now, E is the one that's mostly involved when we have allergic type reactions. And by allergic, I mean full-blown allergic. So we're talking about things like anaphylaxis. Say somebody has a full-blown allergy to peanuts. They eat a peanut, their throat closes up, they can't breathe. That's an IgE, full-blown allergy. IgA is what we call our mucosal immunity, meaning that it's the one that protects us on the surfaces of hollow organs. Things like your gut, for example, has tons of IgA in there because it's one of our first lines of defense. Your saliva has tons of IgA in there. Again, first line of defense. So as soon as the IgA encounters something that doesn't belong there, you get that reaction. Food sensitivities start with IgA and continue with IgG, IgG being the most common immunoglobulin in the body and the most controversial when it comes to stealth infections. So here's the dilemma, all right? IgG, is it a past infection or is it a present infection? And this is where the discord, if you will, or the divergence lie. So the other way that we have immune, or rather stealth infections happening, is when the bugs hide. And they hide very, very well. How do they hide? Well, Borrelia hides everywhere. And this is one of the bugs that we're going to be covering, so you're going to see what it does in the body. Bartonella, Babesia, Rickettsia, they hide in the blood. So in the blood cells, believe it or not, if you take a smear of a blood cell of somebody that has a Bartonella or Babesia or Rickettsia infection, you'll see it. Rickettsia also lives in the endothelium. Now, we're not going to be talking about Rickettsia today, but let me just tell you, Rickettsia is also known as Rocky Mountain spotted fever, and one of the telling signs of rickettsia is you see these pinpoints of blood throughout the whole body. You'll see these little pinpoints of blood. And that's because the organism lives in the endothelial tissue and it causes these little microhemorrhages all over the place. And you'll see all these, that's why it's called Rocky Mountain spotted fever. You're spotted because all of these little spots of blood spring up everywhere. Ehrlichia and chlamydia live in your monocytes, your macrophages. Remember your cleanup crew? That's where they live. How are they going to get cleaned up if they're living there? We're going to be talking about chlamydia today, so you'll get an opportunity to see a little bit more about that. Mycoplasma is the smallest of all the bacteria. And the problem with mycoplasma and why it's so difficult to detect is because it doesn't have a cell wall. Cell walls are how the immune system goes after the bug. So if it doesn't have a cell wall, the immune system isn't even going to see it. And finally, Epstein-Barr and cytomegaloviruses both love, as I said earlier, the liver. Favorite places for them to hide. So we have so many bugs that we can potentially talk about and so little time. So what we're going to do is I'm going to just cover a few of sort of the main ones and the ones that you hear most about. So the first one I'm going to be covering is the Epstein-Barr virus. And you're going to see that that's a very it's an endemic, almost an endemic virus. The next one we're going to be talking about is chlamydia. The next one's going to be Bartonella. And finally, we're going to be discussing Borrelia. So let's get started. Here you see the Epstein-Barr virus. And the Epstein-Barr virus is essentially what we call an enveloped virus, meaning that it has a shell around it. You can see in this illustration, there's an envelope protein and the envelope itself. So it kind of makes it a little bit more difficult to get to the virus itself. And within the envelope, you can see the viral genome. That's the DNA material. Now, the way viruses tend to infect the human body is literally by injecting the DNA, their DNA into the cell and hijacking the cell for their own purpose. So let's talk a little bit about the Epstein-Barr virus. The Epstein-Barr virus is in the herpes family of viruses. So herpes family of viruses includes viruses like herpes zoster, which gives you, for example, chickenpox. It's transmitted via saliva, hence the name, the kissing disease, mononucleosis, which is the disease agent that's transmitted by the Epstein-Barr virus. So if you share it, you don't have to catch it by kissing somebody. You can share a glass with them. If you share a glass with someone who has the Epstein-Barr virus, you could potentially expose yourself to that virus. One of the things about the Epstein-Barr virus is that it crosses the placental barrier. So it can very easily transmit from mother to fetus. So that's another way of transmission of the Epstein-Barr virus. And you don't always have to have mononucleosis to have the Epstein-Barr virus. As you can see, 95% of the population of the United States is infected by adolescents. 90% of the population of the world is infected by adolescents. So you can see that the situation or the organism, the infection is almost endemic in the population. And one of the nasty things about the Epstein-Barr virus is it will deactivate your vitamin D receptors. Now, for those of you that have heard some of my other lectures, you know how important vitamin D is for properly regulating the immune system. And Epstein-Barr will deactivate it. So it's a very nice way for it to ensure that your immune system has an even more difficult time of finding the infection itself and eradicating it. Now, again, it is in 95% of the population. So if it's in 95% of the population, I'm sure you're probably thinking 95% of the population can't possibly, be sick with this. And you're right. But remember earlier I spoke about the immune system and how important it was to have a healthy immune system in order to keep things like the Epstein-Barr virus under control. Well, there you go. If there's immune dysregulation, if the bug hides, you're going to wind up feeling it. But if your immune system is happy, it does what it's supposed to do, you're not going to have these symptoms. But it has been linked to a lot of different conditions. And let's cover some of the conditions that it's been linked to. Epstein-Barr has been linked to myasthenia gravis, to thrombocytopenia purpura, to cancer, Graves' disease, Hashimoto's, alopecia, and so many, many more. So it's been implicated in multiple autoimmune disease. And here is an article from the Autoimmune Disease Journal that was published back in 2012. CD8 and T cell deficiency, Epstein-Barr virus infection, vitamin D deficiency. Remember what I said earlier? Epstein-Barr virus will deactivate the vitamin D receptors and will make you vitamin D deficient. But I think probably 90% of the population is vitamin D deficient anyway. I mean, I've run hundreds and hundreds and hundreds of blood tests, and I can begin to tell you, I think probably a good 95% of the blood tests, even on children that I run, show vitamin D deficiencies. But when you have an activated Epstein-Barr infection, it's even worse. And this article, the study talks about the steps to autoimmunity because of the infection and the vitamin D deficiency. So here's what it says. CD8 and T cell deficiency underlines development of chronic autoimmune diseases, underlies it, meaning that it is the underlying reason for these chronic autoimmune diseases by impairing CD8 and T cell control of the Epstein-Barr virus infection, with the result that the EBV-infected autoreactive B cells, autoreactive meaning that they're reacting to self, to your own body as opposed to outside foreign objects, accumulate in the target organ where they produce pathogenic autoantibodies and provide co-stimulatory survival signals to autoreactive T cells. So autoimmune disease is the underlying cause could very well be an Epstein-Barr infection that is disrupting your immune system and shutting down your vitamin D receptors. Super important to know whether or not you have a reactivated, because you may have had the infection when you were a child. And when you're a child, Epstein-Barr doesn't show up as anything other than maybe a cold or flu-like symptoms. But then as an adult, if you're not taking care of yourself, what winds up happening is then it resurges. And now we see the sort of underlying causative agent behind something like an autoimmune disease. Systemic lupus, another really nasty autoimmune disease that affects all of the organs. And here again, an increased prevalence of Epstein virus infection in young patients suggests a possible etiology for systemic lupus erythematosus. And here's what it says. An assay for EBV DNA in the peripheral blood lymphocytes. Where is it telling you it is? In the lymphocytes. Established Epstein-Barr viral infections in the peripheral blood of all of the lupus patients. Not some of them, but every single one of them had the Epstein-Barr virus in their lymphocytes. Here's another one. This is a paper on Hashimoto's thyroiditis. Now, as you know, Hashimoto's is the autoimmune condition where the immune system attacks the thyroid gland. In and of itself, the thyroid itself may have no problem at all, but the immune system has decided that your thyroid is dangerous and now it's going after it. So in Hashimoto's, several other putative triggering viruses have been implicated. So we're not just talking even about the Epstein-Barr virus at all, although as you can see, it is part of that, but herpes simplex, parvovirus, rubella, okay, all potential underlying causative agents behind Hashimoto's thyroiditis. Rheumatoid arthritis, another extremely painful and very debilitating autoimmune disease. Again, talking about the Epstein-Barr virus in autoimmune diseases. Both SLE, which is systemic lupus, and RA, rheumatoid arthritis, are characterized by high titers of anti-EBV antibodies. High titers. Remember that, high titers, because we're going to be talking a little bit more about that in terms of looking for whether or not you have a reactivated Epstein-Barr virus. And impaired T cell responses to Epstein-Barr antigen. Again, high titers, high numbers, and impaired immune response, impaired T cell response. Compared with normal subjects, elevated EBV load in peripheral blood has been observed in SLE and RA. So isn't that interesting? Compared with normal subjects, elevated EBV load. So it might have been an infection that they may have gotten when they were 5 years old. But now here at, say, 45, all of a sudden, the Epstein-Barr load is elevating, reactivating, and it's causing the immune system to turn against yourself, against your own body. Here's MS. This is the Journal of Neurological Sciences, Epstein-Barr virus and multiple sclerosis. A possible role for Epstein-Barr virus has been suggested in chronic inflammatory autoimmune diseases, like, again, rheumatoid and SLE, systemic lupus, as well as in multiple sclerosis. So we're back to, you can see the connection between these autoimmune diseases and Epstein-Barr. We're not done. It's even involved in things like Burkitt's and Hodgkin's lymphoma. Diverse malignancies such as Burkitt and Hodgkin's lymphoma have been associated with Epstein-Barr. So it's not just about autoimmunity, but things like cancer, as I said earlier. Here's chronic fatigue. Now, very often, we've heard about Epstein-Barr being associated with chronic fatigue. Well, stress-associated changes in the steady state expression of latent Epstein-Barr viruses and its implications for chronic fatigue syndrome and, again, cancer. And here we're talking about Brain Behavior and Immunity Journal. So this article goes on to say that data provides a new perspective on how an early non-structural Epstein-Barr virus can cause immune dysregulation and produce clinical symptoms associated or observed rather in patients with chronic fatigue syndrome. How many people do you know out there that tell you, oh my God, I'm so exhausted. I wake up tired. I'm so wiped out. I can't even function throughout the day. I need a cup of coffee in the afternoon to wake up. I need to go take a nap under my desk. I don't know how I make it through the day. How often do you hear that? Next time you hear it, you need to say, hey, you know what? Maybe you need to get checked and see if you have some sort of an underlying infection or underlying immune burden that could be causing that. The article goes on to say stress is thought to be a factor in chronic fatigue syndrome. Stress has also been shown to induce reactivation of latent EBV and other herpes viruses and could be a cofactor for risks of developing CFS. Now, I've always said, and I say it every single time, that probably stress is the single most causative agent behind chronic illnesses. Stress is the biggest reason people get sick because when you're stressed, it creates an imbalance everywhere in your system. When your stress adaptation mechanisms don't work like they should anymore because you've just been constantly stressed over and over and over again, everything starts to malfunction. Your immune system, your gut, everything. So it's super important to be able to have some way of managing your stress so that you can at least diminish some of the risk factors associated with developing some of these chronic illnesses. Now, as I said earlier, one of the things that is probably one of the worst things about the Epstein-Barr virus is that it's able to cross the placenta and it can infect that fetus in pregnancy. And it shares that characteristics with other herpes viruses. So one of the most dangerous things about pregnancies very often is the presence of herpes virus, herpes simplex virus, because it will characteristically cross the placental barrier and can cause some real problems with the fetus. So as you can see, this comes from reproductive toxicology. It should be mentioned that both HSV, which is herpes simplex, and EBV, Epstein-Barr, seem to be able to cross the placenta and cause, as described by several investigators, placental infections manifested by deciduitis and villitis. And these placental pathological changes may increase fetal damage. So super important to have your immune system. For those of you out there that are thinking of getting pregnant, please, 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 I would encourage you to go get checked. Make sure that you don't have any kind of an infection that has the potential to cause any problems with your baby. You want to have a healthy baby. One of the things that I do in the office is I work with preconception with patients who want to get pregnant but either aren't able to or have health issues that are preventing them from having healthy pregnancies. And I always check for these infections, and I always make sure that their immune system is doing what it needs to do before I ever give them the okay to go ahead and try for pregnancy. So please, I would encourage you to go ahead and do that. That unborn baby, it's your responsibility to ensure that they're born with at least as many healthy characteristics as possible, so that they don't have to suffer through life having health issues and health problems as well. So Epstein-Barr, really nasty little bugger, will hang out in your system, can reactivate. Super important that you find out whether or not you have it. So let's go on to the next one, and that's chlamydia pneumonia. And the thing about chlamydia pneumonia is it's interesting because it has to go into the cell to reproduce, and then it destroys the cell, as you can see in this organism, and pops out of the cell to go out there and infect more cells. And you remember I said to you earlier that these live in your cells? Well, there you go. Chlamydia is one of the nasty. So let's talk about chlamydia pneumonia infection. Now, this is not the same thing. Most people hear chlamydia and their first thing is, oh, you're talking about the sexually transmitted disease. No, 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 I'm not. I am talking about uh, the upper respiratory infection. Chlamydia tracheomatosis is your sexually transmitted disease organism. Chlamydia pneumonia causes pneumonia. Okay? It causes upper respiratory infections. So it causes things like pneumonia, bronchitis, chronic sinusitis could be a chlamydia issue. Walking pneumonia most likely is a chlamydia. A persistent cough that won't go away. It'll even cause things like conjunctivitis. So, and you'll see as we go along, it is all over the place. It will cause all kinds of things. And the nasty thing about chlamydia is, again, it is hard to get rid of because it infects other cells, as I showed you earlier in the diagram, to reproduce. In other words, in order for it to make more chlamydia, it has to infect a cell to make chlamydia inside the cell, breaks open the cell, and puts out more chlamydia into your system. So nasty little organism, a lot of people have had it because, especially if they've had something like walking pneumonia, they have probably got an underlying chlamydia pneumonia burden on their system. So the thing about this nasty little thing is it's a stealthy hitchhiker because it winds up infecting your macrophages. Now remember we talked about macrophages earlier? Macrophages are your cleanup crew. Macrophages go everywhere. And because chlamydia lives in that macrophage, it goes everywhere. So guess what? It can cross over into places it should never be able to get into. Things like your blood-brain barrier into your brain, where it activates your microglial cells and leads to inflammation. And here's the thing about your microglial cells. Your microglial cells in your brain are your brain's defense system. So what happens is when something gets into your brain that doesn't belong there, it activates microglial cells. And when that happens, that causes brain inflammation. So you know that kind of foggy thinking, well, your brain doesn't have pain mechanisms. So the way you feel that there's inflammation is you start to have these kind of brain symptoms like, oh, I can't remember where I put my keys, or wow, where was I supposed to go? Or gee, I can't get my thoughts together to to say what I'm supposed to be saying. Or wow, I know I just looked at that, but I don't remember what it says. All of those are symptoms of brain inflammation. So if you're getting these symptoms, you need to start looking because there's something going on that's causing your brain not to function the way it is. And here's the thing about the microglial cells. Once they're active, they never deactivate. And what that means is that there is no pharmaceutical out there that will shut down microglial activation. But happily, there's tons of nutraceuticals, natural products out there that have actually been researched and shown to impact microglial activation and help to shut and calm the brain down. So sometimes even if you've done something to take care of whatever it is that's irritating your brain, you may still feel that brain fog if we don't attenuate that inflammation by helping to calm down the microglial activation. So super important to know this. But let's go through and let's talk about the chlamydia pneumonia and what it does. Voila! Chlamydia, pneumonia, and Alzheimer's. Remember, hitchhikes into the brain? So here's an article that was published in Neurobiology of Aging. Chlamydia pneumonia induces Alzheimer-like amyloid plaques in brains of BLB mice. Now, granted, this was done in mice, but still, you kind of want to think, okay, is it possible that this could be happening in human brains as well? And here's what the article goes on to say. Amyloid deposits resembling plaques found in Alzheimer's disease brains were formed in the brains of non-transgenic BAL-B mice following intranasal infection with chlamydia pneumonia. Interesting. So in other words, they purposely infected the mice with the chlamydia pneumonia, and then they went and observed what happened in their brain tissue. And what they found was that they were forming plaques on their brain that are similar to what's found in Alzheimer's disease. So it kind of makes you think, could it be that perhaps an underlying infection is disrupting my brain function? It's food for thought. It's something that you definitely want to think about. Here's another article that was published in Pathogens and Disease. Now, when I say article, sometimes it's an article, sometimes it's actually a study. Most articles are based on studies. So here we go, chlamydia pneumonia in the Alzheimer's brain. And it goes on to say that they assessed the presence and characteristics of chlamydia in brain tissue samples from 25 patients with late onset Alzheimer's disease. Now we're talking about people now. We're not talking about mice, right? And what it showed were that the astrocytes, which are a form of brain cell, which look kind of like a star, that's why they're called astrocytes, the microglia that we talked about, which are the defense system in your brain, and neurons all served as host cells for the chlamydia pneumonia organism in the Alzheimer's brain. And that these infected cells were found in close proximity to both neuritic senile plaques and the tangles and plaques present because of a chlamydia pneumonia infection in the brain. Hello. You have to look beyond the symptom. That is one of the things that is so important to do. I mean, you can't just say, oh, well, you have Alzheimer's. All right, let's forget about it. We'll just give you something to sort of try to bring your memory back somewhat. It may work for a certain amount of time, but oh well, when it stops working, it stopped working and we're done. No. Look for why. Why? What's going on? Look at this. A chlamydia infection, something that causes an upper respiratory infection but has the ability to wind up migrating into the brain. Wow. I mean, that is huge. You really need to, look beyond just the symptom itself. Here's MS. Again, remember we talked about Epstein-Barr and MS? Here's chlamydia and MS. Again, we're dealing with the nervous system. Infection of the central nervous system with C. pneumonia is a frequent occurrence in MS patients. Wow. And although the organism could represent the pathogenic agent of MS, it may simply be a secondary infection, but still, it's there. In other words, it may be a secondary infection associated with the primary infection, which might be brought about by the Epstein-Barr. Whew, that was convoluted. But do you see what I'm talking about? So important to know what's going on in the system because, hey, if we're not going to have MS, maybe we'll wind up with Alzheimer's because we have this, chlamydia pneumonia infection hanging out in our bodies, disrupting our immune system. But that's not all. We're talking about essential hypertension as it relates to chlamydia pneumonia as well. Chlamydia pneumonia antibodies in severe essential hypertension. And here's what the article or the study continues to say. This article is from 1998, so this is not even new information. This is stuff that we know already. Several studies have implied an association between C. pneumonia and cardiovascular disease. And data support an association of C. pneumonia with severe essential hypertension. Have you or anyone you know ever had, say, a diagnosis of, well, this is essential hypertension or this is malignant hypertension. We don't really know why you have it. We're just going to give you a bunch of medication to bring it down, but it's there. Well, could it be that unrelenting hypertension is there because we have a bug that's disrupting our system? Remember what I told you? Where does this bug live? It lives in the macrophage, lives in the immune system. So anywhere the immune system goes, this bug is going too. So it's so important to be able to really assess what's going on in the body and be able to determine, okay, is this there? Is there something we can do about it? Is there something we can give you? Is there something we can, use to be able to get this under control and to get the immune system to eradicate? And we're not done. Multiple infections. Again, this is a review, or rather an article that's in the Advanced Clinical Experiment of Medicine journal. And this one says infections caused by, again, chlamydia pneumonia. And it goes on to say a connection between chlamydia pneumonia infections with other non-communicable diseases such as lung cancer, arthritis, Alzheimer's, MS, sarcoidosis, which is a disease of the lung, and erythema nodosum is also recognized. So we're not just talking about one particular thing that this has the potential to cause, but we're talking about multiple infections that chlamydia has the potential to cause. And that's not all, because chlamydia has been linked to, well, we talked about systemic lupus, but things like abdominal aortic aneurysms. Those are silent killers growing in the abdomen, the aorta that extends from the heart down into through the abdomen to irrigate the lower half of your body. These aneurysms develop without anybody's knowledge and can burst at any given time, and they have been linked to C. pneumonia. Myocarditis, vasculitis, again, conditions of the heart. Stroke, again, all of that sort of encompassing that whole hypertension situation. Guillain-Barré syndrome. Atherosclerosis, which is blacking of the large arteries. Headaches, joint pain, and so much more. Chlamydia is a nasty little bug. And just because you think that you've sort of gotten rid of your upper respiratory infection, one of the things that I see very often is someone saying to me, I was feeling perfectly fine until I got walking pneumonia, and then I never seemed to quite feel right after I got that. Okay. That for me is sort of a flag going, I better be checking some of these bugs because that's something that's probably never been fully taken care of and it's never fully gone away. And so we do, and very often we'll find these, and that's why that person or that patient is not feeling well, simply because whatever it is that they had never fully went away. All right. So again, just like Epstein-Barr, I encourage you, if you're not feeling well or if you've had an upper respiratory infection, don't say, hey, you know what, it'll go away. Think about checking it out. So let's talk about Bartonella henselae, and that's also known as cat scratch fever. Okay, and I'm sure you've heard about cats, and it's like, well, what's the, why would I worry about cat scratch fever? I don't have a cat. Well, that's fine. But Bartonella is not just transmitted by cats. It's also transmitted by dogs. And how many of you have dogs? And fleas, and lice, and mosquitoes, and ticks, and sandflies. It is predominantly carried around by cats. In fact, about 28% of cats have Bartonella. And another thing about Bartonella, as I said earlier, is it's very, very, very difficult to detect. Because why? It lives in the endothelial cells of the blood vessels. In other words, it lives within the blood cells that, or rather the cells that line your blood vessels in the endothelium. And it can cause constrictions of the blood vessels and interfere with circulation. So what do you suppose would be a symptom if something is interfering with your circulation? Think about it. There you go. Very cold hands and very cold feet. Does that remind you of something? Okay. Think about it. How about thyroid? Does that give you very cold hands and very cold feet? I would say absolutely, right? So very often Bartonella symptoms can be mistaken for thyroid symptoms. How about hot flashes, especially at night? What do you suppose that could be equated to? Maybe menopausal symptoms? How about soreness and sharp pains in the soles of the feet? Maybe plantar fasciitis? How about itching in the back of the head? Wow, an allergy of some sort, or rashes? So you can see that the symptoms are so similar to other things that it's so easy to mistake them for something else, right? Very cold hands and feet, thyroid, hot flashes. Well, maybe I'm my hormones, sharp pain. So you have to really consider that when you're looking at these symptoms, because it's not just about, you know, looking at, well, maybe it's thyroid that's causing your cold hands and feet, but it's about saying, well, maybe we've got something else going on that could be causing these cold hands and feet. So cold hands and feet, rather. So you can see that it's so important to look beyond. But here's one of the nasty things about Bartonella, as with a lot of these infections that we're talking about. They're not the easiest thing to detect. They live in the cell. So very often there's extensive testing that has to be brought about. But remember the quote that I started with at the very, very beginning, where I said you have to see the signs and symptoms? Very often combining the signs. If somebody said to me, look, I have cold hands and feet, I'd say, okay, I'm thinking thyroid. Then they might say, but I also have pains in my feet. And I'll be like, oh, wait a minute. Okay, cold hands, they're cold, they've got pains in the feet. Maybe I need to start looking possibly at a Bartonella infection. So you can see how listening is so important when it comes to your symptoms. So let's talk about Bartonella and some of the things that it does. So one of the problems with Bartonella is something called neuroretinitis. What is the retina? It's how you see. It's part of your eye. And here's an article that was published in the Journal of Ophthalmology, Bartonella henselae neuroretinitis in cat scratch disease. Boy, that's a mouthful, isn't it? So B. henselae is a cause of neuroretinitis in cat scratch disease. Compared to historic cases, doxycycline, which is an antibiotic, and rifampin, another one, appear to shorten the course of the disease and hasten visual recovery. You know something? Remember, I do things naturally. I use supplementation, herbs, etc., and diet. I mean, we do things from a natural perspective, but sometimes if it comes to something like my vision, you have to do what you have to do to ensure that you don't wind up losing your vision. So in this particular case, they used antibiotics and were able, thankfully, to restore the visual field, the visual recovery. And then, of course, knowing that antibiotics basically disrupt your system, one of the things then that you want to do is ensure that you pursue the natural approach to make sure that you build up your immune system and that you sort of compensate for whatever the antibiotic may have done to your healthy cells. But in terms of this cat scratch, the neuroretinitis, long-term prognosis is good, but some individual may acquire a mild post-infectious optic neuropathy, and this is where the natural approach comes in and really helps your immune system rather to do what it's supposed to do, right? Here's another article in endocarditis in the Journal of Medicine, and endocarditis is an inflammation of the heart muscle. Okay, so not the heart muscle, but the endothelium. So here we go. Of the 7 recognized species implicated in human disease, only Bartonella quintana, excuse me, and Bartonella henselae have been associated frequently with an increasing spectrum of clinical syndromes. Bartonella henselae is the one we're talking about. These include scratch disease, chronic bacteremia, meaning chronic bacteria in your system, chronic lymphadenopathy. Lymphadenopathies are basically inflammation of the lymphatics, inflammation of lymph, meningoencephalitis, inflammation of the meningeal covers of your brain, myelitis, granular hepatitis, endocarditis, osteomyelitis, inflammation of the bone, bacillary angiomatosis, etc., etc., etc. So you can see how important it is to really be able to handle these infections if, excuse me, if they're in your system. You don't want to let these infections go. Or, sometimes people say, well, it's not really an infection. Well, it's an immune burden, meaning that it's burdening your immune system and forcing it to go and constantly fight a battle that it just isn't able to win. But there are ways that you can help it win. And the way to do that is to ensure that you do certain things to help your body do what it needs to do, to control, if not eradicate, but control, manage these so that they don't disrupt your health in your life. All right, so now we're moving on to the biggie, and that's Lyme disease. And we call this the great mimicker because Lyme disease can mimic pretty much every condition you can possibly imagine. And that is the Borrelia organism. Essentially, it's the Borrelia burgdorferi. It is the most common vector-borne disease in the United States, meaning that it is the most common bug bite-borne disease in the United States. It was first discovered in 1975 in Old Lyme, Connecticut. And the way it was found was because there were about 12 cases of juvenile arthritis that were reported. And when they were tested, they found this organism, this Borrelia burgdorferi. This is transmitted by a tick bite. So anytime you see a tick on you, you want to make sure that you really examine the area if you even able, and we'll talk about that in just about a sec, because I'm going to really elaborate on this particular organism. But you want to make sure that that thing is off. The nasty thing about bacteria burgdorferi is that it has the ability to morph, change into different forms. It changes into something called a cyst. Cyst, kind of think about a cyst, think about an egg. Cysts have actually been found in the brain of Alzheimer's patients. So it has the ability to do that. It has the ability to be a spirochete. Think of a corkscrew. So it can corkscrew its way into tissue. And it has the ability to be cell wall deficient. Remember earlier when I went through the list of common underlying stealth infections, I talked about mycoplasma being the smallest organism, and the reason why the immune system can't find it very often is because the immune system looks for a cell wall to go after the bug, and the mycoplasma is cell wall deficient. Well, so can Borrelia be. Borrelia can actually adopt a cell wall deficient form. That's why it is so difficult to eradicate, because it's it's a bacteria. So technically you would think, well, if it's a bacteria, an antibiotic should be able to clean this up, right? But it doesn't. It's a very difficult organism to get rid of. And one of the things about Borrelia that makes it even tougher to clean up is it loves to live in the immune system. It lives in the lymphocytes, the very cells that are meant to clean it up. So it's very, very smart. It really knows how to hide itself from the immune system. It knows how to hide itself from anything that has the potential to clean it up. So let's kind of elaborate a little bit more on vector-borne disease. And that's a term commonly used to describe an illness caused by an infectious microbe that is transmitted to people by blood-sucking arthropods. Yuck, right? It's like a vampire. Well, this is from the Virginia Department of Health. This is what a tick does. And let's talk a little bit about ticks and what they do. They're nasty little critters. First thing, let's kind of look at a tick. And if you look at the upper sort of right-hand corner of this slide, you see the dime, edge of that one dime. Think about how small a dime. If you go and you grab a dime and you put the dime by you and just stick it there in front of you on the table, that larva isn't even as big as the D on the dime, so you can't even see that if it's biting you. And the nymph is typically what's going to bite you. And look at that nymph. It's not even, it's almost, just almost as big as that D. So it might look like a little speck on your body. You may not even see it. So very often, actually part of my intake forms asks a potential patient, have you ever been bitten by a tick? And 99% of the time they'll say no, because they may not have even seen that they were bitten by the tick, but yet they've been hiking in the woods. So it kind of makes me wonder. It's like, if they've been hiking in the woods, they're saying they've not been bitten by a tick. I wonder. All right. So you have to sort of be very vigilant if you're going to go hiking in the woods. Make sure that you're covered. Don't expose any part of your skin where a tick has the potential to land on you and take a bite, especially, of course, now not all ticks carry the Lyme organism, but if they do and you happen to be bitten by that tick, you're going to wind up having a problem. Now, part of the issue with ticks too is taking them out. And here's the thing about ticks. They're well drinkers. So that means that what they do is once they land on you and bite you, they literally have chemicals in their saliva that dissolves the tissue until it reaches a capillary and causes the blood to pool in the hole, and they feed off that blood that's pooling in the hole. Sounds pretty disgusting, doesn't it? But that's how they feed. So what they do is they bury their head in that hole and then they feed off of you. So it's really important when you see a tick on you to sort of know what you need to do to get it out. You can't just pull it, just kind of brush it off. If you leave that head in your arm or wherever it is that it's bitten you, it's going to create a massive infection. And the other thing about being bitten by a tick that has uh, the Borrelia organism in it is you're going to get this rash. It's called the erythema migrans, and it is a red circular patch that appears usually about 3 days to a month after the bite of an infected tick at the site of the bite. So it's also known as the bullseye rash. I'm going to show you a little bit about that. Here's a tick. Here's an image of a tick feeding. See how bloated it is on the skin? It's got its head inside that hole that it's made, and it's basically drinking from the well of blood that it's created. And here's the rash. Do you see how it looks like a bullseye? Basically, is if for whatever reason you're, anywhere and you get a bite and you see that within a day or 2 to 3 days and it may or may, it may actually, that very rarely does it really last a full month, but if you see that, get yourself right away to a doctor's office. If you catch it early, you can eradicate it right away, but if you wait, that's when we run into problems. So here are the reported cases of Lyme disease in the United States. As you can see, the predominance, all the blue, right? You can see the predominance is still up in the Northeast, right in the New York, right in the tri-state area there, Pennsylvania, Connecticut, all of that area, very, very predominant. And then also in the upper area there by, looks like Wisconsin, etc. Again, predominant in those areas. But if you look at the rest of the state, these ticks are interspersed throughout the state. So it doesn't mean that, say, if you live in Colorado, it's not possible that you could wind up with Lyme disease. Because the illness is spreading throughout, or rather the pathogen, the organism is spreading around the whole country. And it's actually also throughout the world. It's not just in the United States, but it's throughout the world. So there are deer everywhere. There's tons of deer in Colorado, and the deer tick is one of the most common ways that the organism is transmitted. So really important to sort of know what you're doing, where you're going, especially if you're thinking of hiking in woods or in areas where these ticks might be present. You want for sure to be able to get yourself covered so that you don't have a problem. Now, once you're infected, here's what happens. The Borrelia, this bug, will make a biofilm to protect itself. Now, what a biofilm means is it's kind of, think about it like a house. It will make itself a brick home where it can protect itself from being detected by anything like the immune system, for example. And it will replicate within that biofilm. It will also, that biofilm protects it, it nourishes it, it keeps it going basically in your system. And it stops any antibiotic from reaching it by trapping it between two cell walls. So Borrelia itself has two cell walls. So in one of its forms rather. So what happens is when the antibiotic tries to get to it, it will trap it so it never quite reaches the organism itself. The other thing that Borrelia does, and one of the things that biofilm will do too, is it will thicken the blood. So it makes it harder for the immune system to reach it and clean it up. So very smart bug. And one of the places it loves to hang out in is the discs in your back, your knees, and in your heart. And it causes flu-like symptoms. So you might get, swollen lymph nodes, rashes, fevers, chills, brain fog, etc. You also will wind up getting sometimes neurological symptoms, like uh, maybe it might affect the way you walk, your gait, especially once it gets into your brain. So it's a pretty nasty once it disseminates throughout the body. One of the patients that I have had um, anger issues with anger whenever the Lyme would flare up. So you have to be aware of these symptoms. You also have to be aware of, well, where have I been? For example, one of my patients was had a trip to the mountains, came back when they came back, they weren't feeling as well. So again, what happened out there that could have done that? Was that patient bitten by something? Did they come across something? Did they get a tick bite? All of those things have to come into play. You have to think about if you're not feeling well, if you're having some of these symptoms that are persistent. Remember, it's about persistence. And here's the biggest problem about Borrelia. It is hard, hard, hard to detect. And in about 40% of the cases, the tests will come back negative because it hides. It hides very, very well. So let's talk about Borrelia and some of the diseases and issues that it can cause. So one of the things that it does is it lives in the endothelium. So here's an article in Infection and Immunity from 1991, intracellular localization of Borrelia burgdorferi within human endothelial cells. And here's what the article has to say. The demonstration of Borrelia within endothelial cells suggests that intracellular localization may be a potential mechanism by which the organism escapes from the immune system. So again, remember, it's hiding, okay? It's hiding from the immune system, and it's doing its very best not to be killed because it likes to live in your body. That's where it wants to live. Here's another one. Lymphocytes, invasion and cytopathic killing of human lymphocytes by spirochetes causing Lyme disease. Again, this article was in the Clinical Infection Disease Journal, and it was published in 1997. And it goes on to say, we found that Borrelia actively attaches to, invades, and kills human B and T lymphocytes. Significant killing began within 1 hour of mixing. So again, it's disabling, dysregulating the immune system. These results suggest that invasion and lysis, that means destruction of lymphocytes, may constitute previously unrecognized factors in Lyme disease and bacterial pathogenesis. Again, bacterial infections, Lyme disease absolutely destroys your immune system. Macrophages. Here we go, the fate of Borrelia, the agent in mouse macrophages, destruction, survival, and recovery. We can reculture spirochetes from macrophages after an infection. Wait a minute, the infection is done. How come they're still in the macrophages? Because they persist in the macrophages and produce a possible pathogenetic mechanism for chronic or recurrent Lyme disease. So it's like it doesn't go away. It's like this persistent infection that just hangs out in the system. Here's from the CDC. Some symptoms and signs of Lyme disease may not appear until weeks, months, or years after a tick bite. So you may have been bitten 10 years ago and now all of a sudden you're getting signs of Lyme disease. Why? Right? In some persons, the rash never forms. So you don't always get that bullseye rash. And in some, the first and only sign of Lyme disease is arthritis. And in others, nervous system problems are the only evidence of Lyme disease. Lyme disease is often difficult to diagnose because its symptoms and signs mimic those of many other diseases. The fever, muscle aches, and fatigue of Lyme disease can easily be mistaken for viral infections such as flu, mono. Joint pain can be mistaken for other types of arthritis like rheumatoid, and neurologic signs can mimic those caused by other conditions such as MS. So remember I said the great mimicker? Lyme disease is one of the best at mimicking other illnesses and diseases. So let's talk about Lyme disease in the nerve cells. Invasion of human neuronal and glial cells by an infectious strain of Borrelia burgdorferi. And here's what the article goes on to say. This is from 2006. Invasion of neural cells by Borrelia provides a putative mechanism for the organism to avoid the host's immune response while potentially causing functional damage to neural cells during infection of the CNS, CNS being central nervous system. It's damaging the nervous system cells. It's not just, so can you imagine damage to the nervous system cells? What do you suppose happened, right? Here's another an article from Medical Hypotheses. Plaques of Alzheimer's disease originate from cysts. Remember we talked about cysts? That is one of the forms of Borrelia. This article is from 2006, and it goes on to say DNA of the alleged perpetrator at the scene of the crime constitute molecular proof of a spirochetal pathogenesis. So the alleged perpetrator is Borrelia. There we go. And the crime is Alzheimer's. I mean, really, that, as far as I'm concerned, is a crime. Imagine to lose yourself, basically, in an illness that basically robs you of your identity. That's a crime. How about thyroid? Here's an article called Homologies Between Proteins of Borrelia and Thyroid Autoantigens. And here we're talking about autoimmune disease. And this article was published in 2004. And again, our data strengthened the hypotheses of BD, Borrelia, and YE as environmental triggers of autoimmune thyroid disease in genetically predisposed person through molecular mimicry mechanism. Now, I know, remember when I introduced myself, I said one of the things that I like to do is DNA testing. Well, there you go. If you have a genetic predisposition, you're going to be more liable to trigger an autoimmune condition if you're infected with some of these organisms. Now, YE actually stands for Yersinia enterocolytica, and Yersinia has been very much implicated in autoimmune thyroid disease. It actually infects your gut, and it hangs out there, and it creates a real problem with autoimmune thyroid disease. So Lyme's is also linked to a variety of other illnesses. Lupus, birth defects, huge, interstitial cystitis. I don't know if you're familiar with interstitial cystitis, but interstitial cystitis is basically an infection of the bladder or of the urethra that has no apparent, and again I'm putting apparent in quotes, no apparent causative agent. But Lyme has been linked to that because Lyme burrows into the interstitial tissue of the bladder, and it irritates and inflames the bladder and causes interstitial cystitis. So one of the things is, if you know someone who has or you have interstitial cystitis, have them get checked for Lyme disease. And bear in mind, again, like I said earlier, it's tough to detect. There are certain ways to do it, but it can be quite costly to try to find it. But it is something that is definitely to be considered, especially if that person is really suffering with the interstitial cystitis, because it can be a very painful condition. Encephalitis, again, inflammation of the brain. Seizures, oh my God, remember I said that it's living in your brain? Cysts, well, there you go, it causes seizures. Plus so many more conditions, so much more. So again, I encourage you, if you're having symptoms, if you don't know what's going on, if you're sitting there thinking, why do I not feel good? What is going on with me? Get yourself checked. Get yourself checked. So now that you know, okay, what can you do? Well, obviously nothing beats prevention, right? But very often, anyone that has this already have these bugs living inside. And sometimes these bugs have been living inside from babyhood, and they're making your life and your health miserable. So you may have acquired them from mom, you may have gotten them as a baby or as a child, you may have gotten them as an adult, whatever the case. Now that you know what that you may possibly have these things, what can you possibly do to help alleviate or eradicate these organisms? Well, one of the things that you absolutely want to consider is it is much more difficult for bugs to flourish in a healthy body than it is for them to live in a sick body, right? So obviously, the best thing that you want to do is, if you think you have a stealth infection, is to go get yourself checked. I mean, that is obviously the number one thing. But there are some things that you're not, it's not like you have no control. There are some things you can absolutely do to help yourself along the way. And one is to maintain a healthy diet. Those of you that have heard my lectures before know that for me, having a healthy diet, that's the underlying basis of a healthy body. If you don't have a healthy diet, no matter how many pills you take, no matter how much you try to do other things, it isn't going to make that much of a difference. You need to make sure that that you're eating properly. You need to ensure that you're eating a healthy diet. So maintaining a healthy diet does a variety of things for you. Healthy diets help us maintain healthy immune system, healthy gut and flora, healthy white blood cell production, healthy oxygenation, healthy blood sugar levels, because sugar will actually lower your resistance for up to 6 hours after you eat it. Gluten will actually cause your gut to be permeable for up to 30 minutes after you eat it. So it's so important to ensure that you've got a healthy diet, that you're eating lots of vegetables. I talk about it as a sort of a cross between a Paleo-Mediterranean diet. I always like to talk about a plant-based diet, but people misunderstand and think I'm talking about a vegetarian diet. I'm not. When I talk about a plant-based diet, I mean most of your food should be coming from plants, but you must have healthy animal protein with it every single day. So our body is mostly protein. So we need that protein in order to ensure that we're building healthy skin, healthy organs, healthy muscle, but also to ensure that we're making healthy hormones. Your thyroid hormone is dependent upon protein. Your brain chemicals are dependent upon protein. Your neurotransmitters are dependent upon protein. You need to have protein in order for your body to do what it's supposed to do. So not having the protein definitely deprives your system of what it needs. And in fact, I don't believe there's any complete protein in the vegetable kingdom. So it's super important that you have healthy animal protein. What I mean when I say healthy animal protein, I'm like, you have to eat clean, because most of the conventional animal protein out there is fed a lot of um, drugs. They're fed a lot of foods that are alien to their system, that their bodies aren't accustomed to eating, and things that are genetically modified. So all of these things wind up in your body when you eat that. So make sure that you're eating clean animal protein when you do eat animal protein. Maintaining a healthy gut and flora is so important. Vegetables will do that. Your vegetables are your flora's food. So maintaining a healthy flora involves eating lots of healthy vegetables. A healthy white blood cell production. Again, eating a healthy diet will provide you with the nutrients for your bone marrow to do what it needs to do to ensure that you maintain a healthy white blood cell production. Healthy oxygenation. Again, your diet will do that, because if you're lacking nutrients such as iron or B12, you are not going to have healthy blood cells. And if you don't have healthy blood cells, you cannot bring oxygen to your extremities. So it's important to maintain healthy oxygenation by maintaining healthy animal protein diet as well as your plant-based diet. Healthy blood sugar levels. Sugar is a disaster area. Now, I don't know if you've listened to the lecture I have on there already, which is the one on the hidden addiction, but listen to that and find out how sugar is a real problem and can cause a real mess in your system. And like I said, it does lower your resistance for up to 6 hours after you eat it. So if you're trying to battle something, you have to avoid the sugar. Now, bear in mind that in an acute situation, antibiotics are the answer. Again, I am not, an extremist. And those of you that know me know that I don't like extremes. I don't like extreme anything. So there are times when an antibiotic is warranted. But I think antibiotics are overused in today's society. But in a case like this, and if it's an acute, like if you catch Lyme's disease right then and there when you first get bitten, taking that antibiotic will definitely be good. But by the time these infections are discovered, they've already moved into the realm of the chronic. And at that point, now antibiotics aren't doing much of anything at all except really creating more of an issue in your body. But thankfully, there are many natural solutions to support immune function, and in some instances, they actually do a better job of clearing out the infection than medicine. Bear in mind, they're not antibiotics. We're not talking about an antibiotic here. Antibiotics are medicine, they're drugs. But we're talking about supplements that actually help your immune system do a better job of identifying and going after foreign invaders. So, again, and we have a lot of and some of this is evidence, not some, but most of it is evidence based. So we're not talking about things just off the top of our head that we're going to say, hey, you know what? We're just going to give you this because, well, somebody told us that it works. No, no, no. We definitely are, whatever we do from a natural perspective is absolutely evidence based. So having said that, you also need to remember that some of the infectious agents like Epstein-Barr may stay in your system for as long as you live, but they can be suppressed. Just like when you catch the chickenpox. Chickenpox virus stays in your system for as long as you live. But if you suppress these things, then they won't come back to bite you, right? And you do that by maintaining a healthy, nutritionally replete body. So remember that ultimately, it's your health, it's your choice, and I encourage you to make the right one. And if you're looking for me, this is where you can find me. I thank you for joining me on this lecture, and I hope to see you soon.